Dear viewers, now we are doing the interpretation of a barium swallow, and we are looking at a lateral view, and in this view we can see a tubular structure which has been highlighted. And this tubular structure which has been highlighted because we have used a contrast material, and this structure is esophagus. Esophagus begins at the level of C6 vertebrae. It runs posteriorly in the mediastinum and reaches all the way down and pierces the diaphragm at the level of the 10th thoracic vertebrae, and it has a short course within the abdomen. There it becomes the stomach. So now we are looking at its outlines. It's a muscular tube. In the upper mediastinum, it is present behind my trachea. And now first let's look at the bony landmarks which are visible in this given X-ray. And there you are looking at the cervical vertebral bodies against whom my esophagus is running. You can see very easily the curvature. And now after the cervical part, now we have these thoracic vertebrae, the bodies of all of them. And down, we can see the dome of the diaphragm. And after that, in front we can see the outlining which is provided by the presence of the sternum. We can see the ribs as well. And behind, what we can see here, we can see the clavicle and the scapula bone. Now let's highlight the esophagus. Now you see this tube is not uniform. It is narrow at certain points and it's wide at certain points. Why is that? Because we have the peristalsis. And due to the peristalsis, it appears like this. And this is the normal pattern. I'm just highlighting the walls of my esophagus, and you can see down where it becomes stomach. And now, in the extent of this esophagus, which is a muscular tube, it is narrow at certain landmarks. And these narrowings are just because of the presence of certain anatomical structures. The place where it begins, there we have a sphincter, and that is due to the cricopharyngeus muscle. So that is one of the constriction site which is seen in the pathway of this esophagus. When we are coming down, we can see certain narrowing which are very easily visible to us, and there we can see a very clear narrowing which is visible in this location, and we can see here this is because of, there you can see an arrow. This is because my left main bronchus is being closely related at this location. Left main bronchus. And if you look at above, there we can see there is another constriction which has been shown here. Let me use another color. And this is because of the aorta, arch of aorta. And going down, we can see another very prominent area, and this is due to my left atrium of the heart. So these are very obvious constrictions which you can see in this given X-ray.